It's Dr. Casabona here with Irene, and with Irene's position, I'd like to show you a little bit about what we do here. So every time a patient comes in the office, we check them for nerve interference. We do this neurological leg check and we look at the feet. If you look here down at Irene's feet, you can see that this leg is actually shorter than this leg if you look straight down. And what we do is we have her turn her head to the right. Turn your head to the right, please, Irene, as far as you can. And when she turns her head to the right, her feet actually level off. So what that says is that her neck is out of alignment, and what it's doing is pinching the nerves that go to all these muscles in her back, and they cause a shortening or a spasming of the muscles, and the muscles attached to her hip, and they pull this hip shorter, and that's why her leg looks longer. And when she turns her head to the right, that immediately takes the tension off the nerves, and her muscles relax, and her pelvis is level, and her feet show up level here. So that means she needs to be adjusted to that direction. And in our office, we have a very, very gentle instrument that taps the bone and actually helps the spine move to its more normal position or move more freely. So I'm just tapping her neck here, if you can see. Does that hurt you at all?
No.
Okay, it actually feels good. And then we put your head straight, and then we check the feet again. And if that made a correction, now with her head straight, you can see her feet are actually perfectly level. So that means that that actually helps her nervous system relax. Now, we also notice on here that she has a very, very tight muscle, and that's actually better than it was when I first touched you as well. Still a little tight, so we're going to check in here and see which vertebrae is not moving properly, or a couple of vertebrae. And right in here, you can feel these don't move that properly. So when I push in here, there's going to be a little popping sound, very similar to when you crack your knuckles. Inside the joint, there's air or gas. And when you separate the bones or stretch them or gap them, they make a little popping sound, which is totally normal and doesn't hurt, but feels actually good. Go ahead and take a deep breath in and let it all the way out. Good. That's good. Now we're going to have you sit over here in the chair, if you don't mind. And I've treated this young lady many times on and off over the years, and I know she gets a fixation in the bottom of her neck or the top of her upper back, and you can see her head tilts off to the right side. So we're going to make a correction here. It's going to be a little pop. Just relax. Good. And then we're going to come on the other side, a little bit higher. We're going to move that bone also. Relax. Good. Okay. Now, if you wouldn't mind, you can take your mask off. Just tell the audience how chiropractic helped you very briefly in a couple seconds over the years, how it's helped your neck feel better.
I don't know how I'd make it without chiropractic. I go through such pain at times, and right now is a very difficult time because I'm doing some packing and I'm straining some. And this has really, really helped to be in here and to get the adjustments to help through the time of pain.
Sure. So if you have aches or pains or something that you'd like to get looked at, please give us a call at 498-9984. And again, I want to thank you for sharing, and we do appreciate it and love you. Thank you.